This is Dr. Culley Carson reporting a urology video blog from Chapel Hill, North Carolina. Phosphodiesterase inhibitors are celebrating their 10th anniversary. 10 years ago, in March of 1998, sildenafil was approved for use in our patients with erectile dysfunction. As we all remember, phosphodiesterase type 5 inhibitors inhibit the enzyme phosphodiesterase type 5 in the corpus cavernosum smooth muscle cells of the penis, allowing them to relax and respond to stimulation more effectively, producing and facilitating better erectile function. Sildenafil was added to by vardenafil and tadalafil, so there are now 3 available agents in the US and Europe. As the years have gone by, however, we've noted more and more reasons for using this PDE-5 inhibitors, the phosphodiesterase inhibitors, in other conditions. Indeed, these agents appear to improve endothelial health and improve vascular control of a variety of other conditions. Sildenafil has been approved for the use in pulmonary artery hypertension, and there are a number of studies that demonstrate that phosphodiesterase inhibitors can be helpful in patients with Raynaud's phenomenon, altitude sickness, in addition to erectile dysfunction and pulmonary artery hypertension. Because these agents are so versatile, there have been a number of studies looking at other ways that phosphodiesterase inhibitors can improve erectile function. Following radical prostatectomy, a study by Padmanathan and colleagues reported at the American Urologic Association demonstrated an advantage to patients taking sildenafil on a nightly basis in restoring erections following nerve-sparing radical prostatectomy. In our own institution, a nightly study using tadalafil has demonstrated an improved erectile function restoration in patients undergoing robotic and laparoscopic radical prostatectomies. Indeed, tadalafil has been approved by the Food and Drug Administration as a daily agent at 5 milligrams for the treatment of erectile dysfunction. Other studies have demonstrated other urologic advantages to phosphodiesterase inhibitors. Burnett and colleagues from Johns Hopkins have shown that daily sildenafil may improve patients that have significant, especially episodic priapism. McVary and colleagues have looked at the use of phosphodiesterase inhibitors in patients with lower urinary tract symptoms caused by benign prostatic hyperplasia. Indeed, these lower urinary tract symptoms can be improved dramatically by the use of nightly or even episodic phosphodiesterase inhibitors. All 3 of the phosphodiesterase inhibitors, both sildenafil, tadalafil, and vardenafil, have been demonstrated in various studies to improve those lower urinary tract symptoms. Interestingly, in all 3 studies, there's an improvement in international prostate symptom score studies. That means the symptoms associated with lower urinary tract symptoms, but not an increase or an improvement in flow rate in these same patients. Perhaps these agents are having more of an impact on overactive bladder symptoms and bladder hyperactivity than they are on the actual prostate. Studies continue to further elucidate this effect. Suffice it to say, though, that phosphodiesterase inhibitors are celebrating their 10th anniversary. They certainly have treated successfully large numbers of men with erectile dysfunction, very successfully, and are now available for daily use for those patients that respond better to a daily dose of PDE-5 inhibitor rather than an on-demand dose. So patients can take tadalafil on a daily basis with expected improved efficacy. These agents appear safe, are effective, and have stood the test of time with a 10-year history of efficacy, safety, and improvement in erectile function in men worldwide. This has been Dr. Culley Carson with a urology blog from Chapel Hill, North Carolina.